Let me introduce Dr. Lou Valdez, who at the time this study began was our program officer with the Food and Drug Administration and who has recently joined the Pan American Health Organization. Dr. Valdez?
Thank you. And if somebody in the back is, if I can just say next slide, that'll help me, if that's okay. So good morning, everyone. It's really good to see familiar faces. Let me first by thanking the Food and Drug Administration. I probably say that a little bit in tongue-in-cheek because I was part of it at the time. But these types of reports, I think, are invaluable. And one of the things I hope we get out of this at day's end is really a clear pathway of how do we begin to utilize this report and others of a similar nature. And let me also thank the committee. Dr. Wojtecki chaired it, and of course the Academies more broadly. It was a great group of experts, and I am really gratified as I read the report. I think what came through is the dedication and the real coalescing of expertise among the committee members, and the report is the better for it. Let me also say that Dr. Wojtecki said this is a small group today, but I have to say it's an incredibly powerful group. So as I look at this group, I see regulators past and present. I see academics and university researchers. And, I see policymakers. And I think we need all of these together if we're going to really make a difference for the strengthening of regulatory systems. So thank you all for being part of it. Next slide. So when the FDA thought about commissioning the Academies for another report of this nature, this was kind of the backdrop that we saw. Again, the World Bank report, it came out late in the fall of 2018, but one of its main messages was unsafe food costs low and middle income countries $110 billion annually in lost productivity and medical expenses. That was the first time that there was a dollar figure able to be placed on this lost productivity and medical expenses. So it was enormous when it came out. Secondly was the impacts of substandard and falsified medical products, and this is per the World Health Organization. Obviously, the impacts are multifaceted. We have health impacts, which obviously impact morbidity, mortality, adverse health events. There are economic impacts, right, to our patients and our families, and to financial outlays and wasted efforts of families. So there are also socioeconomic impacts, and this is lost income, lost productivity, and increased poverty. Now, another WHO study estimated that the observed failure rate of substandard and falsified medicines in low and middle income countries is about 10.5%, or 1 in 10 medical products is falsified or substandard. And again, when that report came out, that was another piece of information that really grabbed the public to help raise the visibility of the public health challenges regulators face. And then WHO, and Dr. Wojtecki mentioned this one, was WHO has estimated as many as 600 million die, or 600 million, or almost 1 in 10 people fall ill from eating contaminated food, with 420,000 dying as a result, and children 5 and under being at high risk. And I think Dr. Wojtecki said as much as a third of those. Next slide. So one of the reasons the FDA was seized on this is back in 2008, 2009, on the heels of both the heparin issue and infant formula, set about establishing foreign posts in strategically located places around the globe. And when they did that, it was clear to the agency that regulatory systems and regulatory authorities were not well understood and definitely not appreciated. And so, in support of our foreign post and the global engagement of the agency more broadly, we set about to raise that profile globally. And just to take you back, at the time, the environment was there was really limited or minimal data around regulatory impacts, the challenges regulators were facing. There were actually limited reports or limited findings in the literature. And more importantly, no one was talking about regulatory challenges or the systems or the need for addressing this public health challenge. So FDA commissioned, as Dr. Witecki said, the IOM in 2011 for the first report of this nature. It was called Ensuring Safe Food and Medical Products Through Stronger Regulatory Systems Abroad. It focused on the BRIC countries, and it also dealt with what are the characteristics of strong, viable food safe regulatory systems, the need for transparency, the need for independence, the evidence-based decision-making. So that report kind of started the dialogue, so to speak. But we also followed it up, or FDA followed it up, with the WHO Global Surveillance and Monitoring System for Substandard and Falsified Medicines. And what was clear to us that no data system existed. And so we worked with the WHO, FDA worked with the WHO to actually establish this data system. And WHO has grown it over the last 6 or 7 years so that not only is there a network of focal points around the globe that report the incidence of substandard and falsified medicines, but then they work very closely with WHO to trace down the contaminated product and work with countries to actually remove it from the shelves, as well as to get the risk communication information out there so that patients and citizens are aware of the risk and of whatever tainted product it may be. We worked with the Academies on a report called The Problem of Substandard and Falsified Drugs, and this was really within the context of a global conundrum. It was difficult for member states and WHO to figure out how to coalesce around substandard and falsified, and we were somewhat far apart, so to speak, in the perspectives of member states and WHO. So the FDA at the time thought if we could get a report out from the academies around the public health issues of substandard and falsified, it could be a real contribution to that global dialogue, and indeed it was. And so it helped us somewhat break the logjam and took the discussion more away from the politics and back into the public health, to the benefit of all of us. We also then, and Dr. Witecki mentioned this one, lots of people worked on the WHO report on the estimates of the global burden of foodborne diseases. A number of the FDA Center for Food Safety and Applied Nutrition, our CIFSAN experts, worked, and USDA experts worked with WHO for almost over a decade. And it was the Office of International Programs at FDA that helped to get this published because there was so much data that had been collected, but we needed to get it over the finish line, so to speak, and get the information out there. The interesting thing about this report, it was really the first time WHO had tried to pull the data together around food safety issues, and it was clear that we had somewhat of a data vacuum. They were able, for the most part, to only pull it down to the regional level, and many national data was really either weak and or missing altogether. So this kind of report then helped again raise the profile, as well as got member states and WHO to begin to work on how to build national data for better decision making. Not only the system itself for substandard and falsified, but WHO produced a report on the global surveillance and monitoring system for substandard and falsified medical products. This was pulling the data for 5 years worth from its system itself, and they were able to analyze the data that they have and begin at least to look at emerging trends, where are gaps, what types of medicine are we seeing more so in terms of falsified or substandard. And it was interesting to note it was really kind of the less expensive generic drugs, I mean, malaria and elsewise. And while some of us knew this anecdotally, it was the first time we were able to really use WHO's data from its own system to begin to weave that story. This was coupled with the WHO study on the public health and socioeconomic impact of substandard and falsified medicines. And that report was really to try to appeal to the policymakers. So these were kind of two reports hand in hand, the one on the global monitoring system and the one on the socioeconomic impacts, so that not only were we going to appeal to the public health community on what were the challenges on substandard and falsified, but also to appeal to the political leaders and policymakers about why there is good value for money in investing in stronger regulatory health systems. There's two missing on this, so I'll just mention them briefly. One is a very recent study from the Academies that came out late last year, and that's on mutual recognition, mutual reliance. And the purpose the FDA had behind this is obviously the agency itself is working with European counterparts on ways to better leverage GMP inspections between our regulatory authorities, but also to kind of develop a landscape, so to speak, of what countries rely or recognize using agreements with other regulatory authorities. Why do they do it? What is that benefit from a regulatory perspective? And what potentially are the downsides or negative impacts if a regulator relies in different ways or substantially on the reliance of another regulator's work? And I think one of the telling things that came out of this report is that what we really need is some metrics here. We don't have a lot of metrics. So a number of regulators will say, I have entered an agreement with X and Y and Z country. They're working well. We love these mutual recognition agreements. But there's really no data that says, really, what's the value and how have we both expanded our reach, regulatory reach, and what are the potential risks that we as regulators need to be very aware of and cautious with as we roll these out. And I say that because I think a number of low and middle income country regulators are really depending on the stringent regulatory authorities to say these are how these have worked for us. And they're going to need data to make those kinds of decisions. So we're hoping to see in the future there will be some metrics on that. And the last one that's not here is that World Bank study on the food safety imperative for low and middle income countries. The primary author of that report, then at the World Bank, he's now at the University of Maryland with Steve Jaffe. Anyone who has not read the report should read it. It is incredibly far-reaching, practical, and impactful, and it really helped to put, I think, food safety systems back into the front of political and policy dialogue in ways it had not been done before. So there's still reverberations coming from a report of that nature, and we were glad to be able to work with the World Bank and commission the FDA to commission that study again. So next slide, please. But there's other ways that the agency has been collaborating, and a number of the regulators in the room and our PAHO colleagues will attest to these. One is the expansion of the membership of the International Council for Harmonization of Technical Requirements for Pharmaceuticals for Human Use, shortly known as ICH. And ICH, as you know, develops the guidelines in quality, efficacy, safety, and multidisciplinary. But it was founded by the Europeans, the US, and the Japanese national regulatory authorities. It was accompanied by the private sector pharmaceutical association representatives, and that worked really well for a number of years. But about 7, 8, maybe 9 years ago, and I'm looking at SEMA, FDA and Japan and Europe decided, rightly so, I think, to really expand the membership. Obviously, the dynamics regulatorily were changing globally, and so it was time to kind of expand the reach, so to speak. So if you go to ICH's website, you will see a number of other regulators that are actively participating, and that includes, Australia, Switzerland, Canada, Brazil, and a range of Mexico, a range of countries who are now participating in a variety of levels within the ICH context. The second one here is the establishment of the International Coalition of Medicine Regulatory Authorities. And this brings together the executive directors of regulatory authorities from a number of countries. It is heavily represented by a number of our European regulators, but also includes South Korea, Australia, Mexico. The United States, of course, has been part of this since day one. Nigeria is part of it. And it has a number of work groups, and it deals with a number of specific issues. But one of the real values of it has been it is a way for the regulators at the most senior levels to get to know each other and work more upstream and more continuously so that when there's a trend emerging in one of our countries, they can quickly get together and they can begin the dialogue about how, as a group of regulators, can address this before things spin out of control. And while I haven't been at FDA for the last 6 weeks, I'm assuming ICMRA has been working together around a number of things for COVID-19. It's an assumption on my part, but I think it's probably a safe one. The United States FDA has also led in a collaboration with our APEC countries to create a supply chain security toolkit. Now, this toolkit is pretty wide-ranging. It has work on good manufacturing practices, good distribution practices, track and trace, detection technology, internet sales. But they have produced, and with APEC Academies, this toolkit and have put it out for public use so that a number of interested stakeholders, including fellow regulators, can take the tool down and can see how it is relevant and adaptable within a national context. So that has worked well as well. And then the last bullet here is the FAO, WHO, African Union, and FAO, WHO, World Trade Organization's International Food Safety Conferences that were held early 2019. Two things about these are of special interest. Number one, they were both incredibly well attended by very senior food experts, but also national policy experts. The first one was hosted by the African Union in Ethiopia, and I think it was an important input for the AU as they looked to build this food safety continent agency, right, or continent-wide food safety agency. And the second one was in Geneva, where I think it was the first time, and I think it was appropriately done, where we began to really recognize this interconnection which you can't undo, between trade and food, and why we need to all work together to ensure stronger food safety systems. I should also say here that the World Bank Food Safety Imperative Report was an important backdrop to both of these conferences. So you start seeing the pieces kind of fit together, or the dots being connected, so that these types of reports feed into these types of conferences and engagement by a number of important stakeholders. So that's kind of how we were looking at this. Next slide, please. But there's more to follow. There's a couple other things that we have done. Again, let me point back to the Academy's contribution report on substandard and falsified medicines from 2013. Because we were able to break that logjam, WHO and its member states established the WHO member state mechanism for substandard and falsified medical products. They have done a number of things. Current chair is India, Dr. Samani of India, but a number of things have occurred from this. One is better data for all the regulators to use through the monitoring system, and a real raising at the national level of the profiles around substandard and falsified medicines. They hold annual meetings in Geneva that have been incredibly well attended, and there's also a strong steering committee that helps to guide its work. We've also worked really hard to try to increase WHO's budget around substandard and falsified, and we've made a little bit of progress in that, but I think we've really raised the visibility within the organization about the need to focus on fighting substandard and falsified medicines. In PAHO itself, and this has been long-standing, there's a National Regulatory Authorities of Regional Reference. And this is an interesting group because it brings together the most stringent regulatory authorities in the Americas region, but not just to share information among each other for better regulatory decisions and actions, but these regulators have also committed to serve as a resource to the less stringent regulatory authorities in the Americas. So they have really put themselves out there. Mexico, COFEPRIS has worked with the Caribbean group to help build and strengthen their regulatory system. So that dual role of NRAs in the Americas has been quite unique, but also incredibly contributory. WHO has the global benchmarking tool for evaluation of medicines and vaccine regulatory authorities. There was a meeting this past fall on this. WHO is working hard to get more and more regulators assessed through the use of the tool. They have worked very closely with the Pan American Health Organization, who had its tool, and its tool predates the GBT. So how do we put this together into one global tool so that we can begin across WHO regions to have comparable data? And I think the work to be had is, as a regulatory authority or system is assessed, how and what data can we share among regulators so that we can help to better focus and pinpoint where there are gaps and where there are opportunities so that fellow regulators can work together. So lots of good work being done on that end. And then, of course, and we will continue to do this in PAHO, but the FDA has done this as well. We've worked to try to weave in language in the G7 and the G20 context. Those declarations are done and signed by the highest policy levels in each of the G7, G20 member states contexts. And so over the past years, we've gotten language over substandard and falsified medical products, internet pharmacies, as well as AMR. And again, I use this as an example to show how we begin to connect the dots on the political level, the use of better data, the more reports out into the literature and whatnot. Next slide. So even though we've made some real progress, and again, I have to say this report is something everybody in this room should be so proud of. Because I think your fingerprints and your contributions are on it. And so there has been a lot of progress that's been made. But of course, there are challenges that remain. Despite our best efforts, regulatory systems, the profile has been raised, but much, much, much more resources are needed. There are regulators in WHO regions, including Africa region, that have 11 professionals and an annual budget of $90,000. So we've got to help and work together to increase the resources and show good value for money, show why investing in regulatory systems actually has a multiplier effect in public health and in economic terms. I think we're all dealing with COVID-19, and what we're seeing is that environments and supply chains are increasingly complex, but boy, are they global. So whether it's the personal protection equipment that we're dealing with now, whether it's supply chain around APIs or food that is going to be coming through from our Central America breadbasket, so to speak, obviously, these are complicated, and it requires and necessitates good communication among regulators and good collaboration so that we can expand that regulatory reach. Dr. Wotecki mentioned the WHO Collaborative Registration Program, and that is working well, and I'm pleased to say FDA has worked very hard on a pilot basis on HIV therapies to try to really get engaged in the CRP of WHO. This is a wonderful learning tool for less stringent regulators who WHO is bringing together kind of a very hands-on approach to review applications and to see and how to rely on the more stringent regulatory authorities on some of the decisions they may have made upstream, but also while ensuring from their own national perspective that they have confidence that this product that they are approving in their country is safe and high quality. We're seeing more and more regulators participate in the global mechanism. So we have the Pharmaceutical Inspection Scheme, we have ICH, we have the International Pharmaceutical Regulators Program, IPRP. I mentioned ICMRA. One that's very well known, and I think the members are about 187 member states, is the Codex Alimentarius Commission. And I know USDA and FDA over many years has led and provided expertise on a whole range of task force and working groups within the Codex Alimentarius Commission context, which brings better labeling, safer foods, better research, better emphasis on evidence and data. And so that is a shared responsibility between FAO and WHO. FAO, I think, is its primary secretariat, but its member states have been highly active in the work and success of Codex. And then, as I mentioned before, the WHO member state mechanism for substandard and falsified products. Again, going back to the Academies report that came out late 2019, just last year, on mutual recognition, mutual reliance, a number of countries, it was really amazing, really have a number of reports in place with other regulators to rely on their work and use their work as an input to our national regulatory decisions. So we're looking forward, and I don't mean to speak for FDA here, but I think that conversation around what are the metrics that we need to say as regulators these agreements are successful, They are ensuring safe and quality products. They are expanding our regulatory reach. And how do we determine and thus help to mitigate what are the risks that we may be seeing from reliance practices? And for those regulators at low and middle income countries, what are those essential regulatory functions required that need to stay resident in a country, regardless of my approach or strategy to mutual recognition, mutual reliance? So all very interesting regulatory questions, but also policy and political questions. And then I'm glad to say that WHO, its executive board in February, passed a food safety resolution that will come before the World Health Assembly in May. This is the first time in a decade that seems to come up every decade, but the United States and our European colleagues, and joined by a number of countries, Japan and Australia and Canada and Brazil and Mexico, African nations have come forward to co-sponsor this. So we're going into the assembly with a lot of momentum and strength by its member states. So this should be a very interesting resolution, and one that will help frame the forward pathway globally of where we should be working toward in the food safety environment. And then just to say something Kathy said was about international collaboration is an investment in emergency response. That is such a true statement. We are seeing it with COVID-19. We are seeing, and to speak about this region, our own region in the Americas, one of the things we're building upon is the hard work PAHO has done all along since the influenza outbreaks to really help countries prepare and be ready for their response when these types of things hit. So, but we know regulatory authorities are key, whether it's emergency use diagnostics, again, the equipment that will be needed, obviously the drug and vaccine approval processes. So that investment is something we need to keep championing, so to speak. Anyway, next slide. So yes, progress has been made, but what do we do? What must we do? I think there's still a lot of work to be done. We need to work hard and tirelessly so that our national policymakers better understand and help to better understand their national regulatory authorities. Public health will not be achieved. Economic health and development and well-being will not be achieved if we do not have strong regulatory systems. And as more NRAs leverage their regulatory practices, we need to again ensure that that core expertise is secured. And many regulators may indeed need to alter their expertise, but again, do it in such a careful way so that there are not unintended consequences or gaps that we may be inadvertently creating without that careful. But some of the examples, PAHO and Gates have worked on the Caribbean Regulatory Group, and that is a group of all the small island nations. And one of the things that they've done most importantly is really recognize the challenge of verification of product that is coming into the island nations. So product comes in, we think we know what it is, but I have to say it's probably very difficult and not impossible to verify, and so PAHO is beginning to do a lot more work in that area. And obviously the Gates Foundation work in the African economic communities that it has done over the decade. We need to better harness technology and innovation for regulatory decisions and actions. We have talked a lot in the recent years about how do we harness the big data, how do we push out more information so that it is in the hands of others. How do we get the information out or share the data so that researchers can have an opportunity to explore, because they just have a different vantage point, where should the research take us? So I think there's a lot of opportunity in this that we can work together in kind of a public-private way to expand our reach, but use the technological tools, the information platforms and whatnot that we have at our fingertips now. And then I think we need to continue to make the case, the economic case. We know the public health case. We know that. But we need to make the economic case about the return on investment and the value of investing in regulatory systems, both nationally and globally. And I hearken back to Africa's opportunity with their two continent regulatory authorities. One will be in medicine, one will be in foods, and this has been a lot of work has already come about, but much more work is needed. But I think that when a regulatory system is under-resourced, we're placing our citizens and our patients at a risk, and the impacts both from public health, but more so from the economic development of our families and our communities is something that we need to really pull out and make the case for. Let me end by saying PAHO has a report coming out this spring, and I think it is a nice, both an accompaniment, but also another springboard for this report. So the FDA commissioned PAHO for a report on landscaping the Americas region in terms of the regulatory landscape. Where are our national regulators, their scope, their range, the comprehensiveness of their systems? Where is our industry in the Americas, and what are we seeing this is medical products, but where are we seeing the growth in industry? Where are the intersections between the two, industry and regulators, because it is a symbiotic, relationship. And then equally important, what are the emerging trends that we're seeing on the horizon that if we haven't started already to begin to get ready for, we certainly need to do it soon. So that report will come out again in the spring. We're looking forward to it. And I think all of these reports, all of this effort and work has helped to raise the profile, rightly so, around regulatory systems. But I just would appeal to all of you, and as we walk out from today on the discussion with this report, what are those practical steps that we can take individually and collectively so that we're continuing to help regulatory systems being as strong as they possibly can be. So I will stop there and say thank you again to all of you for being here. Thanks. Give me one.
We have time for a few questions, sure. And we can start if there are questions or comments in the room. And also, sorry. So we have time for a few questions if there are questions and comments in the room. Also, for our participants joining remotely, you can mail your questions here, and Margaret, you can manage that. Thanks.
Kathy.
Oh, thank you, Lou. It was a really thoughtful overview, and I very much appreciated the way that you described how these various organizations, their studies, their recommendations can be used to inform action, to develop a sense of imperative that we must be moving in this direction. So I thought you did a beautiful job of setting that up. My question is about your last set of topics and specifically the one about technology and innovation, because now that you've changed hats and are working with PAHO, one of the committee report's recommendations was, a couple of them, one dealing with data sharing, another one with establishing a set of research centers that would be focused on the regulatory science problems and developing solutions through research for them. If you could talk a little bit from your perspective now about what some of the challenges are to more innovation, more technology incorporation within the PAHO in particular, or more globally, if you could.
So, I mean, I think there's a lot going on, and I think most of us don't know it, right? And so it's really about how to push out the information. And I'm going to use PAHO as an example. They have had an information platform for regulators for, Mary Lou's, 8-10 years, right? I mean, it's been a long time. Brazil was part of the design of that information platform. FDA was part of helping to get it established. And that is a place where regulators, through a secured platform, can actually share information, share inspection reports, again, make their own decisions about, do I need to inspect this manufacturing plant, or is this most recent inspection from a fellow regulator enough? And then I can redirect scarce resources elsewhere. So this information platform is secure and it's been used. The other thing that's been interesting, again, from a PAHO perspective, is in the medical device area, where the same platform, because it is secured, it is working with, it started with Brazil and Canada, but Japan and Australia have joined. And it is to use certification bodies to audit medical device firms. And what these regulators have agreed to do is, when the report comes out, all the regulators will rely on that certified body's report, so that we don't have to do, we all win as regulators because we don't have to do 6 inspections. The manufacturer wins because they don't have to receive 6 regulators doing the inspections. And so that's been a way that we can really expand the regulatory reach while ensuring and securing the good information and data that we as national regulators need to make our regulatory decisions. I think track and trace in the foods area is one that it's complicated because a number of national regulatory authorities have their own in place through national legislation. But how do we come together so that there is at least a good alignment along our regulatory system, so we see what we're receiving in terms of data from our track and trace, what is somebody else seeing, and how do we put it together so that we can make better decisions and actions? And so I just think there's going to be a lot of, there's a lot of good work already being done, but I think it's incumbent upon all of us to really, how do we push this information out? And if we push this information out, then we've got to be ready to create the necessary groupings or synergies to really then have it result in some actions, right? Because we're all really busy. There's a lot of good conversation, but we want it to result in 1 or 2 things that'll help regulators kind of help move the step forward, right? So I think those are just a couple of examples, but PAHO has been a real leader in this region, working with its member states in the regulatory sphere. Carlos.
Yes, thank you very much. I think we have had this morning one of the best sessions I have had in a long, long time. Really, Catherine, thank you very much. This has been fantastic, and the perspective that you just gave is really, I would say, unique and very, very rich. There is one question that I would like to make to you, Catherine. What is stopping us in giving this step to give for governments to give the legal framework and to make the economic investment derived from that legal framework? What is stopping us? What is really your naive, if you want, idea that is really what is really stopping, because this is something that should move now.
So what I'm going to give you is my personal opinion and not an organization's opinion. So I don't think there's anything stopping us except ourselves. And I think we need to be very strategic about how we engage. And I think we need to do it individually and collectively. I do think that, for any finance minister or any health minister, you really have to make the economic case. If you look at any country, what a minister is dealing with in any given day is both the rising rates of non-communicable disease, the rising rates of communicable diseases, including AIDS, et cetera, malaria, TB. We're still dealing with maternal mortality. There are issues around children's health and welfare. And so it's really hard because those are I think that the thing is, how do we put a face to regulatory systems, right? Because I can see a child's face in children's health. I can see a person with AIDS in AIDS. But when you say regulatory authorities, what leaps to mind, right? We've got to put a face and voice to this. We've got to make it personal. And we need to make the economic case so that for in a sense, this is kind of what the World Bank report tried to do. For every dollar we put in, you get back X-fold, right? And I have to say, I'm looking at Miko in the back, because COFEPRIS made this case. They had to make it to their Congress. It wasn't enough to say we need strong regulatory systems, we've got to cover the basket of services and safe and high-quality drugs. He had to make the case economically of why Mexico should invest in COFEPRIS and build up their regulatory system. So I think it's those two. I think it's those things. We know that the ministers of health and finance have to make really hard decisions. It's an ever decreasing pool of resources, but we haven't yet made that case, and I think we need to put that face to regulatory issues in some way, shape, or form to make some really real progress. Kathy? And then Miko, I don't know if you want to...
I was looking at Mikel
Yeah.
Arriola, who actually has had this responsibility, and you were able to muster quite a bit of resource. Do you want to comment on this?
Sure, thank you very much, Catherine and Marilu. I think that the best way to translate that investing in agencies is a good investment is underlining the word access to medicines. If you explain that to a president or a Ministry of Finance, you could underline the idea that the agency is the window of opportunity to expand access. And I mean by expanding access to have better prices, mostly for middle and low income countries. Because when you see the expenditure in medicines of a poor country and you compare that to a rich one, you see that there's a huge inequality because poor countries use more resources to buy medicines than rich countries. So if the president doesn't know what COFEPRIS means or FDA or whatever agency, you have to explain to the president or the decision makers that they have a tool within their government, and that if they use this tool intelligently, they will save resources in a scenario where the demand grows. Maybe in public health in Mexico, demand grows 10% yearly, and resources at the best scenario stay the same. So if you use your agency in order to decrease costs, I think that would make a case.
Good. I wonder if Javier Guzman, who headed INVIMA of Colombia as a regulator, may want to also chime in.
Thank you, Marilu. Thank you, Catherine. Thank you, Mikel. I think there are certain arguments to be made But the key thing is, well, the economic argument, as we said, but all goes down to the manufacturing base. If there is a manufacturing base and there is the idea to increase exports, then you do have a case and you can actually work with the industry to strengthen the industry, to increase exports, and to increase the ability of the industry to have better ways to enter other markets. But we need to be clear as well. If you do not have, if a country doesn't have a manufacturing base, increasing regulation might actually go against what's perceived as access, what's perceived as having medicines in the market, because that will basically reduce the number of importers, will reduce the number of low-quality manufacturers. So it is, I think, one key aspect that we haven't discussed here is how the agency could and should work with the industry, and I'm not only talking about pharmaceutical industry, but, well, food industry as well, to gradually increase their standards, to gradually help them strengthen their own processes and their own, quality processes. And of course, you could argue that there's a conflict of interest because you cannot regulate and also, increase capacity building and support them. And there's a lot of pushback to that. But I think there needs to be a role for the regulator to to be seen as supportive rather than only the policeman in the room, only the agency in charge of enforcing penalties and closing establishments. And I do relate to the recommendation on the informal markets. I think the food industry is a more difficult one. Mm-hmm. But I guess all I'm saying is it all comes down to the economic argument related to the manufacturing base and the possibility of expanding that.
Good. I'm looking at Dr. Buckley. We have 2 more questions, and then we'll close it. Is that okay? Good. You have to give me a softball because you're from PAHO.
Thank you. No, since you mentioned the regulation of medical devices, I think is my question is more like a comment and then a question. Of course, we have many more years of regulation of pharmaceuticals, drug regulation, and much more data comparing with medical device regulation. Although it has, I think, several achievements in the last few years, you just mentioned one of them with the platforms that have been developed and the RAPS and RISE, and as a way of exchanging on secure way information among regulators. PAHO also created a platform for exchanging information on the diverse events of medical devices. Is very successful as well. And also, you mentioned several initiatives related to our harmonization convergency for pharmaceuticals. As we don't have time to explore a lot, but I think it's worth mentioning that's another of several initiatives on medical device regulation is IMDRF and IMDSAP, which I think is great in terms of moving towards convergence. And PANDRA, the Pan American Network, has recently incorporated medical device regulation as part of the network as well. And another thing that I think is worth mentioning is that in the Western presentation, you mentioned the global benchmark tool as a very important tool for assessing regulatory capacity. And right this year, we started PAHO with WHO and the regulatory authorities to develop a GBT Plus, which will incorporate medical device indicators as part of the global tool, which I think would be a great. So starting by the end of the year, we should have this ready. So the question after the comment is that how do you see the challenges for the regulation of medical device? If you were talking basically about the same challenge on strengthening regulatory systems, how do you feel? How do your thoughts on some different challenges, particular challenges, or on the situation, the global situation on medical device regulation?
So, again, this is more of a personal opinion, and I am cognizant of experts in the room, including my PAHO colleagues. So I think the challenge with medical devices is the range and scope of product, right? There's so many of them. Ranging from the toothbrush to the hip replacement to what goes into my heart, which is what goes into my brain, or my iPhone, or my iWatch. Obviously, I don't have one. And that just makes it so difficult, I think, for regulators to even keep a handle of what's on the market or what's entering the market. But I think that complexity of medical devices is also its opportunity, right? So I think because of the complexity of products, regulators that regulate medical devices are working much more closely hand in hand because they know they have to, right? There's no way you can cover the waterfront of product, the regulation of product alone. And so you're seeing these regulators, FDA, Canada, Australia, Japan, Brazil, coming together to say, how do we really tackle this? The other thing I'd say about medical devices, and it's really a call for all of you to think about this. So a number of member states in WHO have come to WHO and asked them about what are those information systems, the big data systems that would help trace product, right? And this is really important globally because there's one or two already that exist, and a number of the low and middle income countries are saying to WHO, we need a third. And I'm not questioning the need, but I am suggesting that we've got to be really careful as regulators that you don't have three parallel systems, but rather at the beginning, figure out how are these going to align and how are we as regulators going to be able to share data across. So I would just urge you all to look at what's happening at WHO in terms of this. This probably will come up in 2021 maybe, but it's going to be on an agenda, so to speak, because I just think regulators need to be careful and need to be very involved. And I think a number of experts and WHO would appreciate also hearing from them, because I don't think we want to mitigate any unintended consequences in the medical device, because they're just really so complicated and they're forever changing, right? So there's a constant improvement in medical devices that you see much more quickly. The innovation is happening much more quickly in the medical device arena. We'll end with you.
Thank you, Lou. I thought it was an excellent presentation. I wanted to bring this back to the food side because what struck us when we were doing this report was such the differences between the medical, the drug side, and the food side. And, we came to the realization you had pre-market approval versus post-market approval. But really, when you started talking about the information platform and sharing and the data sharing type issue, what are your thoughts? What's preventing it from moving so well on the food side? I just got back from the GFSI meetings, and the idea of sharing data amongst the third parties was not an easy discussion, and so I'd like to hear more about your thoughts on that.
So I think for foods it is about the not having pre-market approval, but really more post-market approval and surveillance. And I also think that in the foods arena there's a lot of small producers, and so a decision can cripple me or can put me out of business, and I think that risk is so much higher in the foods arena than it is in, not to say it's not in the medical products arena, but it is so there in the foods arena. And I think there's got to be a way, Javier was mentioning this idea of how do you work with industry so that bit by bit, phased in approach, and I think we've seen it with the Food Safety Modernization Act. How do you help producers and manufacturers realize it is in my best business interests to raise my standards, to really adhere to the standards, to really quality again translates into good value for money. But I think it's that, and then again it's really the complexity of just foods that we eat, right? So it's everything from fresh fruits and vegetables, it's the seafood, it's the frozen food industry, it's the cereal industry. I mean, you can just, the list goes on and on. So foods just is really complicated, but I do think that we should look at the results of the two 2019 international conferences, because I think they will give us, there's a way to tease out some practical pathways for us to work globally, for us to work sub-regionally, as well as, this is where I think you can really bring in industry. It'll be hard at first, but I think we can get there. So I think it's worth a shot. Good. Thank you again. This was a pleasure. I hate speaking in public, so it's really nice when it's always over.